1, 2, 3. I'm going to start the webinar.
Good evening. Good evening. I'm watching our participants file in to the room. So welcome. We're going to give just maybe a minute and a half for everyone to log on. So I'm going to watch the clock here, but welcome to our next episode of Parental Guidance, COVID-19 in 2022. We thought we would be done talking about COVID in 2020, but here we are. It is still a very, very important and hot topic. So we are excited to bring you not one, not two, but 3 UHealth Jackson Children's Care experts tonight. So we are going to get your questions answered. We've got a lot of questions to address. It's a very important topic, as I said. So I'm going to give just another minute for people to log in. But while they do, I'd like to take a minute and draw your attention to a few things that you may or may not be aware about. The pediatric emergency rooms at Holtz Children's Hospital, as well as Jackson North, are available to you. Oh, and also Jackson West are available to you 24/7, and they're all staffed with board certified pediatric emergency life specialists. And parents and kids are going to get access to every pediatric subspecialist at Holtz Children's Hospital from the University of Miami Health System, as well as the Jackson Health System. And interesting enough, the Holtz Children's Hospital offers a 24-hour kids only emergency room. So there, the doctors and nurses are certified in pediatric advanced life support. And I want to draw something to your attention as well, that the UHealth Jackson Urgent Care Centers have partnered with NSU Card. Now, if you're unfamiliar, that's the University of Miami Nova Southeastern University Center for Autism and Related Disabilities. So they have partnered with the urgent cares at UHealth, and they're achieving now autism-friendly designation, which is the first in Florida. So this designation means that the staff at all 5 urgent care locations have been specifically trained, and all of the centers have a specially designated sensory-friendly exam room to give all patients the opportunity to experience healthcare in a safe and controlled environment. I just think that is awesome that they are making those accommodations. So bravo, Jackson. We love hearing that. So I wanted to bring that to your attention. I want to go ahead and get started this evening because we have so much to cover. We know that your time is valuable, as well as our experts. So we plan to finish up here right around 9 o'clock. So we will watch the clock there. And I want to draw your attention to a few things. So if this is your first time joining us, say hello in the chats. Tell us where you are listening from. We love to know where you're listening in from. And then also you'll see at the bottom of your screen, there's a Q&A feature. If you have a question during any point of our webinar tonight, you can drop your question there. We will do our very best to get to all of those questions. We always have a lot of questions, and we love that. This is your chance to interact with our experts. So I will do my very best to get all of those questions answered. I see someone's watching from Boston. Welcome. Go Red Sox. Had to say it. But anyways, we're going to dive right in. My name is Sierra Bragan. I'm the owner and founder of Miami Mom Collective. We are Miami's premier parenting resource, and our heart and our mission is to encourage, equip, and empower moms and families. And we do that by providing resources like webinars like this. So we're thrilled to partner with UHealth Jackson Children's Care. We also offer events for moms and families. So you can find us on all the social channels and at MiamiMomCollective.com. So if we can serve you, we're here to serve you. But tonight, I'm going to go ahead and introduce you to 2 of our 3 experts. We're going to kind of divide our time up tonight. We're going to talk a lot about COVID-19, the updates, the newest variants, that sort of thing. And then we're going to transition and talk a little bit about COVID and mental health, because if we've learned anything through this whole scenario, we have just understood just how fragile we are as individuals, and that's okay. And there's a lot for us to learn there. So we're going to talk with Dr. Poulopoulos tonight about COVID and mental health. So I will get to her here in just a minute. but we're going to start with actually two guests who have joined us before. The first is Dr. Brandon Chatani. He is an assistant professor of clinical pediatrics at the Miller School of Medicine in the Division of Pediatric Infectious Diseases. So this is his wheelhouse. He's associate program director for the Pediatric Infectious Disease Fellowship Training Program at He's also a published researcher with ongoing projects about COVID-19 and viral infections among transplant recipients. So beyond all he does for medicine, he is an advocate for the most vulnerable youth. So Dr. Brandon Chatani, welcome back for like the 12th time. We're so glad you're here.
Thank you for having me.
We're thrilled. And then also Dr. Lisa Gwynn has joined us before. We're thrilled to have her back. So she is the Associate Professor of Clinical Pediatrics and Public Health Sciences at the University of Miami Miller School of Medicine. She's also the Interim Division Chief of Child and Adolescent Health. She's also, I don't know how you do it all, really, Dr. Gwynn. I really don't know how you do it all, but she's also the Medical Director for the Pediatric Mobile Clinic, which is so cool. This is a program that provides a medical home to uninsured children. So in addition to that, she's program director for the School Health Initiative, which oversees 9 pediatric clinics in Miami-Dade County schools. So she's also leading the community with mobile immunization program, COVID-19 testing, and she's a board certified in pediatrics and a fellow of the American Academy of Pediatrics and president of the Florida chapter of the American Academy of Pediatrics. So you both are doing so much. I don't know how you even have time to be with us tonight, but we're so thankful and we're so grateful. And we want to just get started because we all have a lot of questions. So again, those of you who are listening, if you have a specific question, drop it in the Q&A feature, not in the chat because it's hard to keep up, but in that Q&A feature, and we will do our very best. So, all right, COVID-19, tell us about the Omicron variant and what do we need to know?
So as we've learned throughout this entire pandemic that the virus likes to change, and as it changes, we have to change with it and make sure that we're prepared for what it brings to us. The Omicron variant and how it has affected pediatrics, how it has affected children is slightly different in that we see it's very highly infectious, more infectious than any of the other variants. And it's causing a little bit more disease among our unvaccinated population, where we see them getting hospitalized, requiring a lot of respiratory therapies. So we're seeing the effects of this yet again, another surge.
Right. It's so interesting. I feel like, we've been having these webinars, many different topics, but we started, we had the initial COVID topic way back when, and I felt like we were all kind of like, do you know someone who maybe knows someone who has COVID but now it's like you've either had it or someone that has it. So it's talking about how transmissible it is now, this new variant. It's like everybody probably knows someone right now who maybe has it. So you talked about how it's different for children than the previous variants, way more transmissible. So talk to us about what are the scenarios when kids have to wear masks versus when it's okay if they don't.
Understood. Yes, I know that's on the mind of a lot of parents right now. Because of how transmissible it is, it's still important that in every scenario that we can, wearing a mask is advisable. Now, certainly there are those scenarios where you're outside, you're distanced, you're among your small cohort, your family, your immediate family that should all be vaccinated, then that is a safe scenario where you can be more comfortable without a mask.
And I would agree with that. I do want to add, the American Academy of Pediatrics just came out with data showing that over 1 million American kids were diagnosed with COVID-19 just last week alone. So
last week? I thought you were going to say in the last, month or two.
During the last week, yes, which is 17% higher from the previous week. And that was doubled from the week before that. So we are still on an increasing trajectory. And so one of the ways that we can help prevent infection is, of course, masking. And we can talk more about the type of masks that are most appropriate for kids to wear. But I agree with Dr. Chatani. It's best to, wear a mask indoors, especially. And, a lot of kids are getting infected within, family settings. It doesn't have to necessarily be in school. It's amongst, family members and friends. And so we just can't let our guard down yet.
Yeah, that's right. What about as the COVID numbers are going down, what activities are safe and unsafe to do with our kids?
So as numbers go down, it'll be safe again to participate in some of those group activities. I would say, again, it's going to go by that edict that if it's inside with large groups, that's just going to be unsafe at this current time. If it's outside and they're able to be distanced most of the time, that is a safer environment. So we're talking about outdoor sports. If we're talking about track and field or where there's not a whole lot of contact, that's going to be safer. Right? So each individual sport or activity that they're taking a part of, you think about it of, okay, well, how do they come in contact with another individual? Is that individual masked? How far is that individual most times when they're around them? And that will give you a sense of, okay, well, is this going to end up being safe or not?
Mm-hmm. It's good. We're talking about masks, circling back to that. Are masks still recommended if our children are vaccinated?
Absolutely. They still need to wear a mask no matter what. Just because you're vaccinated doesn't completely keep you immune from, getting infected. Of course, if you are vaccinated, the chances of you having significant disease is very, very, very low, which is good news. So masks are recommended. Of course, the CDC has kind of amped up their guidelines in terms of N95 masks. For kids, I mean, N95 masks are extremely uncomfortable. When we have to wear them all day long in clinic, it is, it's uncomfortable. So, it's hard to expect a young child or even a teenager to keep an N95 on all day. I mean, that is the ideal, but we are realistic. If you can get KN95s for your kids, that's the next best thing, followed by a surgical mask. Any mask that can fit nice and snug on the face and a way that you can have a nice seal to keep your the air from coming out or in from the sides is really your best bet. And we recommend cloth masks only if they're double or triple layered. We don't recommend any of those scarves that kind of come up over the nose and you wear them around the neck. That's not protective enough. I don't know if Dr. Chatani has anything else to add to that, but.
Yeah, I remember when we first started this, I had a metaphor exactly for this question. And it was that it's all about filtration. The more that you're able to filter and have that barrier between you and the outside, the more protective it's going to be. So like making a nice cup of coffee, you don't want the coffee to spill over the sides or go in and get all grainy. You want that nice seal. And the more layers that are there, the tighter the layers are, the better, smoother cup of coffee you're going to get out of it. So that's really where we're going to have to focus for Omicron because it gets in there and it's so infectious.
Yeah. Hey, when you start talking coffee, you're really speaking my language. And now I'm really tracking. I think other moms can agree. Like, did he say coffee? Is there coffee? No, teasing. So good. We had a question come in specifically, Dr. Chatani. This guest asked, do you think that COVID might weaken our immune system and make us have a higher chance of co-infection of other viruses such as, she says HSV, maybe RSV? I'm not sure.
So there are a lot of theories going on directed about that. Nothing has been proven that it does such things. We do know that the other viruses are kind of getting their way right now, mostly because we went a little bit lax on the masking and contacting in the past several months. So we're seeing a lot more adenovirus, RSV than we have seen in previous seasons. This has more to do with our practices and our behaviors than it has to do directly with COVID. So that's what we know so far. We're still learning more every day. I learn every day, read something new every day. So as we get more information about that, I'm sure that we'll be on to share it with you.
That's great. We'll just keep these going. Be like, new info, join us. That's
And
right.
yes,
That's
the
great.
guidelines are changing so regularly and rapidly. It is hard to keep up with it all, not just from the CDC, but also
Yeah.
from the school districts as well.
Right.
Keeping up with their guidelines. It is evolving very, very quickly.
That's right. If we've learned anything, we are adaptable, right? More than we thought we were. Okay, we got a question from the audience as well about masking. This attendee says, how many uses can a child ages 2 to 4 like keep using a surgical mask like at daycare, or a KN95 mask, or a cloth mask with a filter? Like, are there different, would you say an N95 you can use multiple times, or a cloth one and done? Like, what would you say about the mask usage?
Well, one of the things is you have to make sure that the elastic doesn't stretch out to where it no longer has a tight seal. Okay. It's basically, it isn't any different, in terms of the cleanliness of it. I mean, if your child takes their mask off and it's filthy inside, you're going to need to change the mask, so everyone has to use their common sense. But certainly they can be used over again. And the key is definitely to preserve that seal, to make sure it's nice and tight.
Absolutely. The only thing I'll add is just being aware of how wet it is. If it gets wet or soiled, that will destroy that filtration barrier that we're talking about. So I know my kids are it's right there in their mouth, and they lick and eat and put it on, and then it comes home and it's a soggy mess. And like, oh, right.
Yeah.
You're getting washed today. But the cloth masks are nice for that very reason, that you can't just wash them and then reuse them. That's perfectly safe. But the N95s are a little bit more, the KN95s are a little bit more durable, and stay away from the mouth so they don't get wet as easily.
That's good. I can say I've pulled a mask out of the bottom of my purse before and thought, it's kind of scary down there. I don't know if I want to put this on my face. No, all great tips. Thank you for that. Okay, so let's talk about, our kids, they miss their friends. We want to have a play date. Is it safe? And if so, can we do it at our house? Should we do it outside? Our playground safe? I was at the playground today with my kid, and my little one was like chewing on the swing, and I'm like, no, don't put your mouth there, so is it safe? Is it safe to go to the playground? Is it safe to have a play date?
It is safe. You have to take all things into consideration, have that conversation with the other parent. If you're having a play date, are they vaccinated? Are they keeping their distance? Are they staying safe? Have they been recently tested, or any illness that has been ongoing? Those are the type of conversations that have just become a norm, that we need to be having open and honestly with each other. Whether you're a parent sending your child to school or planning a play date, if your child is sick, they shouldn't be interacting with others, because then they're just promoting the illness. Whether it is some other virus or COVID, you just got to use that we're a community, take part in the community, and keep everybody safe.
And I would just add, we want our kids to go out and play. There's nothing that we want more, to get them outside and running and socializing. But it has become polarized, even on the playground, because you have camps of parents that are anti-mask, and then you have other camps of parents that aren't. So my recommendation is exactly that, to have play dates with people that already, that you can have those conversations ahead of time, so that everybody's on the same page, and that nobody is uncomfortable when they get out on the playground and you have a confrontation with the parents, and then the kids are sitting there saying, "Mommy, Daddy, I want to play," So
Yeah.
It isn't any different on a playground as it is in a grocery store. It's like we all have to kind of play in the sandbox together.
That's right. That's right. On that note of socialization, you both mentioned that, it's something that we want, we desire is healthy for our kids. We received a question, and this mom has a 16-month-old. She says they've been very strict with family and people coming into the home, but they're also, concerned about socialization. Do you have any suggestions? Her and her husband, she said, are vaccinated and boosted. So would you say, like, okay, venture out to the park, or what would you, and of course it's always a cost benefit analysis personally, as you mentioned, but just for someone who's thinking, socialization for my kid, how would you advise them?
Well, I
Absolutely.
just want to say that the kids that are 4 and under, the age range where they're not able to get vaccinated yet, we really feel for that age group and for the parents of those kids, because they have no way to protect their children other than to wear masks. And when they're under 2, all bets are off to keep the masks on their faces. Even over 2, it's hard to get them to keep their masks on. So that is a struggle, and you just have to be extra careful with the people that come into your home, and the people that, again, going back to your bubble, your cohort of family and friends that are safe and that are vaccinated, and you have to do the best that you can. But I think socialization and being with family and friends is still very much important for them.
That's great. Thank you. Circling back, another question kind of related to the playground and mask wearing. And you mentioned this, if you're outdoors, to consider like proximity and that thing. But this attendee asks, if outdoor playgrounds are safe, should they wear a mask outdoors while at the playground with unknown kids? We don't know that kid over there. So what do you suggest?
So that's really going to be with the comfort of the parent of, well, is it worth the risk? So if there's that unknown element there, it makes it difficult to say like, yeah, sure, go without a mask, because that risk is going to be there. I try and take my kids to the playground during times when I know it's not as busy, so not during peak hours. I try and plan play dates with kids, with families that we know, and we've had that discussion, and we go to little spots, like not the big climb up and everything playground, but just an open park is everything to run and play. You bring a ball, that's all you need. I mean, we don't have to make this complicated of how we play, how they play. They make their play happen. You can set up an environment that's safe and still allows them to socialize and play, for sure.
Agreed.
Okay, great. Okay, what about kid birthday parties? How many people is too many to have at a social gathering? Any advice there?
Yeah. If you could have it
We have
outside.
some very specific questions tonight. I'm bringing the heat.
Birthday parties that you have, we've heard it time and time again, where entire birthday party participants all get infected. Family events, it spreads like wildfire. So, we recommend, if you can have it outside. Of course, we're very fortunate here in South Florida. The weather's nice, and we can have things outdoors. Up north where it's cold, it is more challenging, and to have anything outdoors, obviously. So again, I think that goes right back to the same things we've been saying. Knowing the people that are around you, and just protecting yourself and your children by wearing a mask to be safe.
Yeah. So some numbers that we've gotten from the CDC is trying to keep parties less than 10 people in a closed space. And certainly if it's a smaller space, then you're going to reduce that number to be meaningful, to where you can still stay distanced and masked and have that interaction. Outdoors, you may be allowed a few more people, for sure, just depending on that space that you're able to accomplish. The length of birthday parties is another thing to consider, because the longer that you stay in contact with others, the higher the risk is that you will contract or someone will spread COVID. So if you're there having a 4-hour birthday party, it's tough. That's a tough sell. I'm sorry. But if it's a short gathering.
What Miami birthday party is less than 4 hours? Come on.
I don't know.
Well, and it's the size of the location, right?
Yeah.
4 hours in a huge house and everyone's spread out. Again, this is just, common sense and, using your better judgment. I mean, it's pretty clear, if you walk in the house and it's like everyone's on top of one another, that's not going to be good. So
I saw something. We were invited to a party and they had the birthday cake, and it didn't even occur to me, because we're so steeped in like our traditions, but it was time to like sing happy birthday, and the kid blew out the candle on a cupcake. And I was like, oh, because you don't want to blow
right,
the cake.
right.
What a great idea. So there's ways to do it. Great. Okay. More questions, specific places. Is it okay to go to the zoo, bowling, museums, bounce
Yes,
house
yes.
reviews.
Yeah, a lot of those places are great. You want to go during non-peak hours, obviously, because being in a packed bowling alley may not be ideal. But the zoo is nice and open. Again, just like Dr. Gwynn said, we're blessed with a wonderful environment, so we can go to the zoo and enjoy the weather. And there are a lot of outdoor activities that can be taken a part of, and it's fine.
We
Here's a
wouldn't
question.
recommend ball pits or bouncy houses or things of that nature. Those types of activities are not recommended.
No,
Okay.
but outdoor putt-putt golfing, so much fun.
Okay, we got a question about the pool. Is it true that the virus is killed with chlorine in the pool?
So I've read both. I've read
Okay.
where it is, and I've read that it's not.
Okay.
So the pool environment can be touch and go depending on what contact is being had. I don't know anybody that's swimming right now, though. It's kind of cold.
It's
But
supposed to be very cold this weekend.
if you do have access to a heated pool, I would say then obviously you're not wearing a mask, because you cannot wear a mask while you're swimming. But you would have to make sure that you maintain that distance if you're with others that you don't know their status.
Gotcha. Okay. A lot of questions from the audience, so I'm bringing them at you. Okay, here's one. And this is not something I've thought, even just as a parent, just in this season. One attendee asked, if our toddler gets sick with a cough or a cold and tested COVID negative, how safe is it to go to the pediatrician? That's kind of the thought right now of like, we're well, but maybe if we go to the pediatrician, maybe we aren't because we catch something. What would you say to someone considering that?
Well, we don't recommend not coming into the pediatrician. I mean,
Right.
We want to see our patients because that just to examine them and make sure that they don't have anything serious. So, it's up to each pediatrician's office in terms of their protocols. Some offices are doing sick visits initially through telehealth to kind of do an intake. Some are recommending testing out in the community before they come into their practice. So everybody has a little bit different protocols, but I would not recommend keeping your child home and not going to the doctor because your child is sick. So.
Mm-hmm. Okay, that's good. What about if a child or adult is still coughing? Are they contagious? Or at what point are you still contagious?
So you're still contagious if you're still symptomatic, meaning that you have symptoms like cough, fever, runny nose. Those symptoms are highly contagious. Any of the fluids that are coming from your mouth and nose are highly contagious. And when you sneeze or cough, you send all these tiny little particles. If you YouTube the coughing, sneezing video, I promise you, it will change your world of what you see is around you.
Yeah.
If you're having those symptoms, you're absolutely still contagious. Please keep your distance, keep a mask on.
Okay, great. All right, another attendee asked, I've heard that COVID affects kids different than adults. Is it true that the virus likes to affect kidney cells more than lung cells? And are there any long-term effects after getting COVID? Like, what are the known long-term effects after getting COVID?
Well, that's a loaded question, Dr.
I know.
You can.
All right. So what we've learned so far is that the virus enjoys a protein. We'll call it ACE. That protein tends to grow with us. The amount that's there grows with us as we get older, especially as we get into adolescence. That protein is located in our lungs, and that protein is located in our kidneys. However, what we've seen so far is that the infection I haven't really seen it affect kidneys so much, like the function of kidneys. With Omicron, what we've seen that is a little different is that we still have the same lung disease that many children had before. But also we're seeing some changes in how children are thinking, that they come in confused, very tired. And this is a term that you might hear like encephalitis, where it seems like an infection of the brain. Now, we don't have a way of proving right now whether or not the infection is there, but we do know that after having COVID or while having COVID, some kids may have these symptoms that could be more tied to the brain, which is kind of scary. So certainly if you see these symptoms where your child is confused and more tired than usual, and you're concerned about COVID because there might have been an exposure, please seek medical care so that you can get your child evaluated sooner rather than later.
And I would just like to add that even though the hospitalization rates are still low compared to compared to adults, there are kids that still get very, very sick. And so we have to keep that in mind. And also, we don't know the long-term effects of even very mild disease. We're still learning as we go. And so this isn't just like a common cold, like what a lot of people are starting to say about Omicron. We're still in the middle of this, and we're still learning as we go. And we are seeing serious complications in some children, and we just don't know it. Sometimes it happens in very healthy children. So again, it's the best thing you could do is to try to prevent it from happening in the first place.
Thank you. A question just came in, Dr. Chatani, off of one of the things that you said when you're referring to that confusion, with the brain. Do you see that in a certain age range, a specific age range of
No age range that we've tied it to. Actually, we've more tied it to the unvaccinated. That those children that are too young to receive a vaccine, and those adolescents that have not received a vaccine, those are the kids that we've seen more so have had this. There are a lot of terms on the internet that you'll find. I don't trust Dr. Google. So I would say talk to your pediatrician about it if you still have a lot of questions, or if they want to refer you to an infectious disease doctor like me. We can always answer those questions one-on-one. But yes, it's more in the unvaccinated children, which can be a little age specific, right?
And if I can just add about vaccinated children, we still have a long way to go. We only have about 30% of 5 to 11-year-olds, and about 60%, I think, of 12 to 18-year-olds are fully vaccinated. Our booster rate in 12 to 18-year-olds is, I think it's only maybe 15% tops. I mean, our numbers change every week, but we have a long way to go to get our kids vaccinated.
Talk to us about this, because we received a question that says, why ask vaccinated versus unvaccinated if you can still transmit whether you're vaccinated or unvaccinated? You want to speak anything to that?
So it's like having a princess in a castle. That princess is your child that you're trying to protect. And with each thing that you do, you're going to build the barriers that keep the virus from getting to your princess. Having the vaccine should be the last barrier of protection that's there. So that if the virus gets past the mask, the moat, if the virus gets past social distancing, past the walls of the castle, and finally gets to where the princess is, at least you have the vaccine that will prevent the serious disease that would happen if the virus actually got to the princess. So that's how we kind of stage it in setting up these different barriers. The vaccine is internal, right? It's causing an internal barrier that allows us not to have such severe disease. The hospitalizations that we're seeing are because the virus has truly penetrated all levels and is unchecked. The body isn't stopping it, isn't buffering it from the true disease that it can cause.
What a great metaphor.
Yeah, he's coming with the metaphors tonight.
We
got coffee, we got princess. What else?
Love it.
Together.
I have a 6-year-old girl, so yes, I better talk about princesses.
I'm like coffee and Disney movies, like all the moms are tracking.
We got it
now. A few more questions on that note. Any news when ages 5 and under will be able to get vaccinated, and would it be 2 or 3 shots?
So that's really tough, and I don't have great news with that one. So in the latest update in December from Pfizer, we saw that there was a delay. There is a delay that we're dealing with right now. And that, the Pfizer was working to make the dose that we give for that age group the safest that it could be. And they proved that it is safe. We got that. But we wanted it to be effective, right? Like we want it to work the way that it has been working for everybody else. The issue with the smaller dose is that it didn't prove to be as effective. So now they're going back to the drawing board and saying, well, we know this dose is safe. What if we just give, instead of 2 doses, 3 doses? And that's what we're waiting to hear back from. So although we were hopeful that, hey, we got the down to 5, and it worked great at the dose, and it was effective, it was safe, let's go, we're gonna have to wait a little bit longer for the youngins.
And it's true, in the babies, it's a little bit more challenging, because to get the dose right of exactly the volume that you need. And also babies, they don't have as robust of an immune response. And that's why, when you have to bring your baby in every 2 months to get boosters, it's because they just don't have a mature immune system to be able to produce a robust immune response like older children. So this is the trickiest age, really. And so, yes, as Dr. Chatani said, it has been proven to be safe, which we're all very, thankful for. It's just now getting that dose right to be able to induce a high enough immune response so that the body can produce enough antibodies for protection.
Great. Oh, you guys have so much information to share. This is great. I hope we can get through everything here. Okay, here's a question. What would you say the risk is with interacting with people that are vaccinated and boosted, but have recently recovered with COVID? And if I understand correctly, the vaccine doesn't keep you from transmitting. It's like you said, that tower, that princess in the tower, it's protecting the princess, not all the other necessarily servants in the kingdom or whatever. So speak to that, the risk associated. Bad analogy. I can't do your analogy.
So if I'm understanding, so they were vaccinated and boosted, and now they had the infection. And now
just what they're asking, what is the risk associating with people who, have been vaccinated and boosted, but also have recently recovered from COVID? Is there a different risk?
Is there a different risk? No, the risk is still the same. It's still the same. As far as we know, the risk is still the same. The only thing that it might change, what we're still learning about, is how long that vaccine lasts for. So now that we know we all need to get a booster at a certain time point, as depending on the situation, that time point might be different if you had COVID per se. But with the new variants, that also makes it complicated. Where we're just sticking with, you get your booster on time as it's being recommended, and it keeps everything simple.
All right, great. I'm firing them at you. We got a few more minutes, and then I want to give Dr. Poulopoulos some time, and then we'll have some time again at the end to circle back to more questions. But one question is, with kids, on average, how long after exposure is like the contagiousness like the highest? And this mom, I think, is asking in relation to maybe COVID positive classmates. She's thinking they have it, like how long is that contagiousness at its peak, I guess?
Yeah, that's a hot button question right there.
Yes, it is.
All the mamas and all the classes.
I'll let our infectious disease specialist tackle that one.
So the CDC has changed the regulations around that a few.
Oh no, I think he froze.
Yes, we did.
I'm sure he's got some great information. Hopefully he's going to circle back.
Look, everyone's like, no.
We're all like, wait, no, tell us. Dr. Chatani.
I know, right?
I know. Okay, let's give him a second, and then we'll interrupt ourselves again if he comes back. But let's keep going.
That's fine. No, and the CDC has changed their, and again, this has to do with the variants and the infectiousness and the contagiousness of it. And, unfortunately, anytime between 2 days before the symptoms and then 2 days after the symptoms, that's when they thought that the infectiousness was the highest. Having said that, you're still infectious, as he mentioned, from the secretion. So if, chances are it's just like any other, upper respiratory infection, you end up with congestion and a cough long after that initial highly infectious stage. I also want to mention the fact that the antigen tests, the rapid tests right now, are not as accurate with the Omicron variant. And so we're seeing people that are testing negative, even with symptoms. And in fact, they do convert to positivity with the antigen test, but it's way later. It's a very kind of weird window now. So just because your child or you are symptomatic and you test negative for the antigen test, you could test yourself again 2 days later and you could be positive. Really, the gold standard still is a PCR test.
Okay. Great feedback. Well, hopefully Dr. Chatani will be able to join us again, but we're going to keep going. Just maybe one or two more questions and then we're going to transition. But here's one. And here he comes. We'll give him 1 second to see if he can log back in. Okay, this is a question I think I can answer because I've been listening really well and I'm learning so much from both of you. Dr. Chatani, welcome back.
Sorry about that. Wow.
No worries. Dr. Gwynn really picked it up and shared, some great information circling back on you're still contagious with those secretions. So contagious is contagious, but anything that you'd like to add, you go ahead.
So the time period, we're sticking with 10 days. I know the CDC has something about 5 days being the limit from your positive PCR. The information that went into that decision is really about the workforce and trying to maintain the American workforce during this last surge. For our children, though, we want to be as safe as possible, right? Barring that we don't want them to miss a ton of school. If they're positive and symptomatic, 10 days is the recommendation. Schools should not be requiring a negative test to return to school, though. They should be without symptoms, though.
Okay. Great. I'm going to fire 2 more questions at you, and then we're going to transition and circle back. But should my child get a booster shot of the COVID-19 vaccine? And are children of any age eligible for the booster?
So the first one is yes, they should get the booster. The second one is no, not all ages are approved, only 12 and up.
12 and up. Okay,
Yep.
Great. And when should they get the booster? Is there a time frame?
5 months.
So 5 months. Yeah.
Go ahead.
You're absolutely right. 5 months is what's recommended for Pfizer. If you happen to have a teenager that's 18 or a young adult who's older, they can get Moderna, and it's again 5 months after the second dose. If they got the Johnson & Johnson, it's 2 months after their first dose. So that's why mostly we're trying to everybody's pretty much preferred to do the Pfizer or Moderna for those older adolescents, young adults.
Okay, great. Last one. Will a COVID-19 vaccine protect us against new variants?
We don't know that. We only know what we know.
We don't know the new variants. What's the next variant, right?
There are studies right now on the Omicron variant, and they are changing the vaccine, if you will. So that's up and coming. This technology is truly amazing. It's kind of like a plug and play. It's similar to what we have with the flu vaccine every year. We change it up every year based on the most common strains that are found around the world. But this is really more high tech, and you could literally take the protein chains that make that variant unique and just plug it right into the existing vaccine, and it's done. So it's truly amazing.
It is. It is really amazing. And there are studies about Omicron showing that there is some cross protectivity, that even if you get the 2 doses and you get the booster, you're 22 times more protected than otherwise. So there is some protection that's there. We're going to just hope and have faith that will maintain for future variants. But as future variants come up, your community, your children's hospital is here to figure that out and help.
And I just want to add, we talk about 90% effective, 95% effective. That's unheard of in the vaccine world. These other vaccines that we've given for, decades don't have that high of efficacy. So, we've set the bar very, very high with these messenger RNA vaccines and technology. So, I think we've gotten a little bit spoiled. But they really, truly are amazing and effective.
That's right. Well, thank you both. We could make a 5-hour webinar of this, and I wish we could. We are going to keep going. Thank you so much, Dr. Chatani, and I'm excited to introduce you to Dr. Poulopoulos. Now, some of you may be thinking, oh my goodness, 15 minutes for her. Why have we not given her enough time? But I will say we're excited. She's going to actually join us for an entire webinar. So we're going to have her completely March 31st. So go ahead and mark your calendar. She's going to circle back with us and give a whole night to this topic because it is so important. But we want to whet your appetite for it tonight. So we're going to be talking about COVID and mental health. But I want to tell you about Dr. Poulopoulos. She is an pediatric psychologist within the Pediatric Behavioral Medicine Service at Holtz Children's Hospital. She's a member of the Society of Pediatric Psychology, has co-authored several peer-reviewed publications and presentations focusing on pediatric populations, and she's an advocate for sexual and gender diversity. So she's doing great work. We're so glad you're with us. We know that you're coming back. You know you're coming back. So we hope you haven't felt slighted tonight. But we're so excited to jump into this important topic about COVID and mental health. So thank you for being with us, Dr. Poulopoulos.
Yeah, of course. I think this ties in very nicely. And I think just some of the questions that were asked, I mean, socialization, child well-being, that's psychological factors as well. So I'm glad that we're able to have this conversation together.
That's right. Oh, I'm so thankful. So talk to us about the current state of mental health in the US and how the pandemic has had an impact on kids' mental health. I think maybe we weren't even thinking about kids' mental health before this. I know I wasn't. Pandemic, and now I'm like, this is a real issue. So talk to us about that.
Oof, what a scary thought. Because, sadly, so what we do know is that in October of 2021, the Children's Hospital Association, the American Academy of Pediatrics, declared a national state of emergency in children's mental health. So this was brewing prior to the pandemic, and the pandemic has really been an exacerbating factor. Like you all already mentioned, there's new variant surges, there's evolving guidelines, information is constantly changing. I love that we only know what we know and we're continuing to learn more. So what we do know about mental health in our kids is that the CDC also estimates that 1 in 5 children do meet diagnosis for a mental health disorder. That's 20% of our youth. Even on a different note, in 2021, the CDC reported that emergency room visits for suspected suicide attempts increased by over 50% from the year prior. So, I'm not saying that's the causality of the pandemic, but that's definitely a factor that's playing a role. That is now making suicide the second leading cause of death in individuals ages 10 to 24. So, I know I kind of throw the big statistics. There's also individuals who are just living with a lot of anxiety, living with a lot of depressive symptoms. All of the mental health disorders that we have at baseline are just being exacerbated by the pandemic.
Wow. It's sobering. It is so sobering. I mean, to hear that, it's kind of easy to kind of operate in our world and we get, sucked into other things. But those statistics are staggering. How, as parents, I'm a parent, I have little ones, but even little ones, but also parents of teens, like how can we start a conversation with our children about their mental health?
Mm-hmm. And this is a really common question. I always say that parents know their children the best. I'm just the expert that helps empower parents and a catalyst for conversation. So I encourage that parents model talking about their emotions and normalize talking about mental health within their family system. And this is through modeling. So having adults in children's lives identify their emotional experience, and not only the positive, the negative, because that's the holistic experience of being a human, labeling them, labeling challenges and how you overcome them, because we know our kids are modeling what they're seeing from us. I always say, listen more and talk less. That's a huge, huge factor. And really validating, it can go such a long way to validate your child or any child's experience. We know that children who feel that they have an adult that they can talk to, they often tend to show better outcomes. Another big thing I say is just, you can start with a really simple question, like, what's been on your mind lately? Sometimes kids may not be so receptive. It's kind of like coming home from school. How was your day? It was fine. So sometimes I think more targeted questions could be, tell me something at school today that you really were looking forward to, or tell me something that you felt was disappointing for you today. And that starts to just generalize the conversation and also normalize, the dialectic of, I had a really bad day and I'm really excited that I'm home with my family. So I think those are good starting points.
That's good. I love those open-ended questions too. It's so easy as parents to be like, did you have a good day? Yeah. Or nope. And you're like, well, why not? And so that's so good. Just getting in that habit, making that just part of your routine when you have pickup or you have dinner or whatever. I love that. So important and so much that we can get from our children just in conversation. What about, are there signs, or what signs should parents be on the lookout for in terms of assessing our children and their mental health?
Mhm. And again, parents know their children best. So, you start to see patterns in your kids. I always say, is your child engaged? Are they connected, and are they functioning what for them is daily functioning? So are they functioning at school, and are they functioning at home with chores, with obligations, with commitments? If you're seeing any sudden changes in sleep, appetite, or eating, that's often a concerning thing. I think you should be inclined to ask a little bit more about that. Also, seeing if your child is refraining from activities they used to be interested in. Are they not playing soccer as much anymore? Are they not calling their friends anymore? Are they withdrawing from you? Are they withdrawing from other family members that they've been close to? Sometimes what we see with kids, we often think of depression as sadness, which it is. But what we also see in kids and teens is that depression can look a lot like irritability and anger and low frustration tolerance. So looking out for that. What I think we see more in our little kiddos is a really big separation anxiety from parents or from adults they're really close with. So that can also be a signal that they're feeling really nervous when they're on their own, and that can be a sign of anxiety.
That's great. We received a question from the audience, and you just nailed it. The question was like, this might be loaded, but what should we be looking for in each stage? And so I feel like you really, you just covered that, and it was great and so concise. But I thought that was good what you said too about irritability and like the anger piece, that you're not just looking for a child who's blue and Eeyore and sad, but those other things to look for at those different, developmental milestones. It's really, really good.
I also want to emphasize, I was just going to say, I want to emphasize that, I don't want to come from an angle of mental health disorders, but just mental health. So just, even if something isn't meeting criteria for a diagnosis, our psychological functioning is so important. So I often encourage parents to be proactive and be preventative as opposed to coming in for intervention, because we can talk about these things before they get to a threshold that they're diagnosable or that they're needing a higher level of treatment.
That's good. That's great. Just like physical health, we don't worry about our physical, like be proactive. So I think that's so good. Sometimes the word, even the phrase, can have such a stigma, and it doesn't need to. So I appreciate you making that open for everyone. How do you best, this is a good question from our audience, how do you best explain pandemic, that term, and just what we're living in to a toddler without causing like fear and anxiety?
Mm-hmm. Ooh, these are great questions. And I really say always, I say for me, it's case by case. So understanding your child, how your child responds, and the age of your child. I often say using developmentally appropriate language. So I think for our kiddos, what we do know is that it's best to be honest. Secrets or exaggerations, we see just across the literature for kiddos that that's not the ideal way to communicate. We can be really straightforward with our kids in a way that just, it's kind of like, when I explain death to children, I say that the body stopped working. So sometimes just a very simplistic description. I'm not saying that about COVID or about pandemic, but just that's actually more helpful than making these stories or what can sometimes be like fibs for kids. So I think for pandemic is, there's a virus and a lot of people are getting sick. And the way we know we can be safe is we can see our doctor, we can get our poke, and we can wear a mask. So just really simple language.
Yeah, that's great. And talking too about, mental health for children, but also I would say for adults, right? It's so important for us to take care of ourselves, because so much of that is going to be, I feel like, infused to our children. Maybe the fear that we're not dealing with, or those things that might be, challenging for us. That's kind of, our kids pick up on that, right? They pick up on that stress and that things that we're carrying too. So,
and we know that parent mental health actually does impact child mental and physical health. So there is a very strong correlation in what you just said.
Mental and physical. And oh, wow, that's good. Wow. Say that again for the people in the back. That was good. Talk to us about, here we got another one. Actually received a question earlier and I saved it. I tucked it away in my brain because I said, this is for Dr. Poulopoulos. But one attendee asked, how do we explain to our kids, like going to a playground, but we're like, okay, like don't just get all up in every other kid's space because of this pandemic that we're living in. Like, how do we coach our kids through that in a healthy way?
Yeah, I think it's about being realistic. So it's kind of the idea of you're putting the entire cake in front of the child. The child is going to dig into the cake. I mean, it's just, I'm going to dig into the cake. So what you're exposing, right? How much? So like Dr. Chatani said, going that are not peak hours, maybe going with other families that that they're vaccinated and they also maintain distance. So giving them the ability to do the task or the fun activity within the confines of what's safe. In terms of explaining to kids, it can just be that it's the and or the if then, right? So if you wear your mask, then you can go to the playground and you can play with the other kids that are there. So I think even for kids just making fun games, like, I always joke and I put one foot in front of the other with coworkers in the beginning of the pandemic to show 6 feet. So it's just like, making things a game that's also actually informing kids.
Yeah, that's good. Okay, here's a question from the audience. For the small nonverbal kids who have who've had limited exposure to other adults and kids, what are signs that there maybe could be an issue?
So you mean like young kiddos that haven't really been socialized yet?
Yeah, maybe ones that haven't. Like, is there something that you're like, oh, that's kind of like maybe something to note?
I think in general, I think in general, we just think going back to developmental milestones of when kids are likely starting to, and these are conversations to really have with a pediatrician who are looking at their developmental milestones about when they might start their speech, when they're walking, they're talking, they're crawling, all those things. I think with kids being nonverbal, I think if it gets at a certain age and it's impacting their schooling and their learning, that definitely warrants a conversation with a pediatrician who can then hopefully provide the appropriate referrals.
That's great. Speaking of appropriate referrals and stuff, let's just talk about, this is something we're all facing. We're all in this together, and we're learning so much. And even just tonight, just hearing from you, a parent might be going, wow, like, okay, maybe we need to look for some help. Where can we find help for our child or our teen?
Yeah. And I will say that I'm a huge advocate for mental health, if that's not obvious, and mental health is health. So I hope that this encourages conversations for parents. I hope destigmatization continues to happen because this is the world that we're living in and change is needed. I think this pandemic has just shed light on the mental health crisis that was already going on both for kids and adults. So the first line of defense, as I always say, is call your pediatrician's office and ask for a list of behavioral health referrals. Sometimes they may even have psychologists or psychiatrists that they've built a relationship with that they know work with kids. So that's a good starting point. From there, you can also actually go into your insurance provider and see what behavioral health providers are in network for you. If you're calling those providers and you're not able to find someone, because I will say, another thing we're seeing is that waitlists and referrals are growing for mental health exponentially. Waitlists are months on end. It's extremely challenging to get your child in. So if you're calling a provider and they don't have an opening, I often use them actually as the guide and say, can you lead me in the direction of any other referrals you know of or anyone you know in the community? After that, I talk about community mental health. So what community mental health is in your area. So for example, Jackson Behavioral Health is in our community. Even going further, looking at local universities, do they have clinics where there's perhaps like graduate clinicians, because sometimes they have more openings. A great online tool is Psychology Today, and that maintains a very large list of providers, and you can actually filter by what you're looking for in terms of like depression, anxiety, your insurance, your location. And then the last two that I'll say are two numbers I always encourage everyone to write down, and that's the National Suicide Prevention Hotline. So that's 1-800-273-8225. And then the Teen Talk Hotline, and that's 305-377-8336. And those are really great resources just to have for all families available.
Awesome. Would you repeat those numbers just one more time?
Of course.
I'm trying to type them and I'm going to put them in the chat. So
yeah, no. So the and honestly, you can Google these and they'll come up, but it's the National Suicide Prevention Hotline. That's 1-800-273-8255. the Teen Talk hotline. That's 305-377-8336.
Okay. I tried to get those here in the chat for you guys, but I'm sure we'll have them here on the end of the, it's hard to spell words while talking. So like, here we go. And then the other one was the teen hotline, right?
Mhm.
Great. I put those in the chat for you. I'm sure we'll have those here on the slide. If not, again, Google is our friend, not our doctor, but our friend in helping find a great doctor. So there we go. That's our encouragement for you there. Dr. Poulopoulos, thank you so much. And as I mentioned, you are going to be back with us March 31st, and you are going to have the floor. And so we are going to, between now and then, I hope those of you who are listening will mark that date, circle back and bring your specific questions, because this is what she said. It's not, something to think about when it's an issue. It's always something to think about. It's always something to be keeping our pulse on. Again, our own health as moms, as dads, as caregivers, but then of course our little ones as well. So this is so important. And we're so glad that you joined us tonight. We're excited to give everyone a little taste of what's coming. I feel certain there was so much engagement tonight, so many questions. I'm sorry if you asked a question, we didn't get your answer. We did our very best. We were rapid firing them, but I'm sure we're going to do this again because this topic is so important, and it's so needed and engaging for all of us. So please join us again. I do want to bring your attention to our next webinar, which is happening 2 weeks from tonight. That is Thursday, February 10th. It is hard to believe that February 10th is in 2 weeks. I feel like it's just flying. But we hope you'll join us for the next parental guidance episode, which is on the topic of puberty. So puberty is a normal part of life, and it's still common for kids to feel anxious, excited, confused about it. So talking to your child about puberty is very important, and having those discussions is so key. So we're going to be doing that on our next parental guidance episode and learn how to address the changes that your child will experience during puberty. So make plans to join us February 10th. Again, if you enjoyed tonight and you want to share it with a friend, you can find this later next week. We'll get the recording up on jacksonevents.org. So it's jacksonevents.org. You can also go back and watch any previous webinar. We have a myriad of topics. There's at least half a dozen or more specifically about COVID, but again, dozens of other topics. So check us out there, jacksonevents.org. And then you can screenshot this little screen here if you want these additional resources, things that we've talked about tonight. So we hope that is helpful for you. Dr. Chatani, Dr. Gwynn, Dr. Poulopoulos, thank you so much for your time tonight and your expertise. We love having you. Thank you. Thank you. Awesome. And to all of our guests who have joined us, thank you for sharing your time with us tonight. We hope that we will see you March 31st for Dr. Poulopoulos. And then, of course, before that, February 10th for our next episode on the topic of puberty. It's hard to talk about, but we're going to do it. We're going to do it together and equip you to have these conversations with your children. So thank you again to Jackson UHealth Children's Care. We're so thankful to be able to bring you this resource. We wish you all a wonderful evening and a happy and safe weekend. We'll see you soon.